The University of Texas Health Professions Office proudly presents Is a Gap Year for You? You may have heard of students taking a gap year between completing their bachelor's degree and continuing on to their professional graduate school training. Some think that there is a stigma associated with taking a gap year and that gap year and year-long vacation are synonymous. However, a gap year can be an excellent time to become fully prepared for health professional school and for the start of a career in your desired field. Before we discuss what you can do during a gap year, we should first answer the question, why take a gap year? There are many excellent reasons to take a gap year, each targeting a specific focus for the student in question. Some students need more time to build up extracurricular pursuits, such as medical volunteering, lab experiences, shadowing, and more. Many health professional programs have explicit requirements for hours spent in these types of activities. If a student did not have the opportunity to complete these requirements while completing a degree, utilizing an extra year post-graduation can be a good idea. Another common reason to take a gap year is to strengthen one's academic standing, such as working on a weak GPA or entrance exam score. Even if you don't have a weak GPA, taking challenging courses during a gap year can help you become a stronger academic candidate overall. This approach may work in conjunction with other reasons when considering a gap year. Completion of prerequisite coursework is crucial for acceptance to health professional school. Those who did not complete all the required courses can do so during a gap year. Having strong letters of evaluation from professors, superiors, or mentors is an important part of an application to any health professional school. Students who do not have such contacts may consider taking a gap year in the interest of obtaining a stronger letter. For most students, funding an education takes careful planning and consideration. It may be a healthy financial decision to spend a gap year working full-time in order to pay off academic debt and/or save money. Some students, for a variety of reasons, do not feel ready to start health professional school immediately upon graduating. A gap year can be a source of rejuvenation to help avoid feeling burnt out and a way to renew enthusiasm for the career path. Before applying or writing personal statements, a gap year can be used to figure out exactly why you want to pursue your specific health professions pathway. Discover your true motivation and be able to convey them in your application essays. A gap year can fulfill one or more of these goals. Before you decide whether or not to take a gap year, first reflect on potential weak areas of your application. Make an appointment with the coach in the health professions office who can help you by evaluating your transcript, resume, and more. Combining your own personal reflection and the professional opinion of a coach will help you decide if a gap year is a good idea. If you come to the conclusion that a gap year would be beneficial in your journey to health professional school, you can then choose the activities you complete to help strengthen your weak areas. Here are some guidance to get you started. Regardless of which areas you are targeting, stay busy during the entire year. Don't just sit around. When you apply at the end of this year, you want to demonstrate substantial reasons for your decision to take a gap year and have something of merit to show for your time. Many students take a gap year to delve into research opportunities, like a laboratory work or helping execute a formal clinical study. If you are interested in these activities, you may decide to work in a lab, either paid or as a volunteer, and hopefully end up getting published. Participating in research showcases motivation and a strong passion for science. Gaining extensive experience in a healthcare setting like a hospital, emergency room, or free clinic is an excellent use of your time if taking a gap year. Whether it's a paid or volunteer position, acquiring this type of hands-on work can strengthen your application tremendously. To improve your chances of gaining a position, you may want to consider training to get certified as a medical tech, EMT, phlebotomist, etc. Shadowing is an integral part of any healthcare professional school application. You can spend your gap year getting your foot in the door of your desired profession. Establish relationships with professional mentor figures, and figure out why you are really pursuing a career in the healthcare field. Taking classes during your gap year is the solution to a variety of different reasons for taking the gap year in the first place. Students may decide to take classes if they want to work on boosting their GPA, if they haven't finished all the prerequisite courses, if they want to remain in study mode, or to supplement their academic knowledge by taking classes they were unable to take as an undergraduate, like anatomy or physiology. Regardless of the reason, taking challenging courses strengthens you as a candidate for health professional school. Schools weigh entrance exam scores heavily when considering your application, so whether you are retaking an entrance exam or taking it for the first time, you can set aside at least 3 months of intensive studying for your exam in a gap year. Because entrance exam preparation does not generally take up an entire year, you can also accomplish other activities to strengthen your application in the months after taking your exam. Many students want to start working off their debt or saving for health professional school during the year after they earn their bachelor's degree. Gaining a full-time paid position in a healthcare environment would be wonderful, but this is not often possible for all students taking a gap year. In the interest of practicality, taking any full-time paid position to pay debts or save money is a smart financial decision. As long as you work hard and use the position to develop the personal qualities needed for a good healthcare professional, any position can be used as a positive learning experience that you can discuss in a personal statement or interviews. A post-grad year may also be used to work on a meaningful, sustained professional relationship with an individual who will be able to attest to an applicant's strong character and competency. As long as you remain committed to your main priorities during the gap year, you are absolutely allowed to enjoy yourself. Consider taking some time to travel or indulge yourself more deeply in a hobby. Always remember to relax a little by doing something as simple as going back to your hometown and spending time with family and friends. A gap year can be a very effective use of your time in your pursuit towards health professional school. However, there are definite ways of talking about a gap year that can convey that your time was spent meaningfully. When discussing your gap year, avoid phrases like time off and vacation. Instead, talk about how you used the time or opportunities available to strengthen your own knowledge or improve skills that will help you become a better healthcare provider. Remember to be honest. Share what you've learned, how you've grown, how you've improved weak areas, or how you've recharged and reconnected with your goals. Have reasons for your decisions and results from your actions, not just, "Oh, I chilled during this year." Remember to make an appointment with a health professions coach if you're considering a gap year. We'd be happy to meet with you.